everyone! So this video might be a little bit all over the place, but there are currently 10 days until my surgery. If you haven't seen my last few videos, then I will link them in the description, but in short, I'm making a series of videos documenting the final stages of my cleft treatment in the hopes that it will help people feel less alone if they have to go through this too, because I know I would have really loved to have seen some videos about it before actually starting the journey myself. So I've had 6 cleft related surgeries so far, and there's a chance that this one could be my last. This video explains what my surgery is a lot better, but basically in a nutshell, my surgeon is going to be reducing my turbinates and adjusting my columella in the hopes that he'll be able to improve my airway, because right now it's pretty rubbish thanks to my cleft. And he's also going to be doing what he's calling an investigation of my nose whilst I'm under general anaesthetic. Because of my cleft, everything up there is pretty complex and it won't be your typical nose operation. So he is going to be doing a little bit of an investigation in case there's anything he could do to help me in the future. I have been waiting for this surgery for years. I'm not even joking. It kind of feels really surreal that it's actually happening soon. It's just come around so quick. So this video today is just going to be me preparing for the surgery basically. Like I said, it is 10 days away, which is absolutely crazy. Yeah, let's just get on with the preparations. So first of all, excuse the weird position that my dog is sleeping in right now, but to help my surgeon understand the complexity of what my nose is like before the operation, he asked me to get a CT scan done. So the first bit of preparation for this surgery was to go and get that done. Like I've said in a lot of my videos before, I do travel quite far for my treatment. I've always gone to Great Ormond Street Hospital in London for my cleft care. And this surgery is actually being done by a specialist surgeon in Southend Hospital, about 4 hours away from where I live. So yeah, flashback to a few days ago when I made the trip down there for my CT scan. So the scan is all done. I was literally in there for like, what, 5 minutes? We weren't waiting long. They just got me in, and they got me in before my appointment time. So I think I got in at about 2:45. My appointment's not even till 2:30, so that was pretty good. 4-hour journey back now though. So today is 1 week before surgery exactly. It's the 25th of August, Friday the 25th of August. My surgery is a week today and I'm very nervous, but today I have my pre-op appointment. It's just over the phone because I literally went to Southend last week for my scan and I'm going to be going again next week for the surgery. So to save me making the long trip, my pre-op's just going to be over the phone. So yeah, basically if you've never had a pre-op before, I've had many, they just have to ask you a bunch of questions. Usually when I've been there in person, they do like some obs as well, so they do like blood pressure, height, weight, whatever else. But yeah, right now I'm just waiting for the call and I will let you know how it goes.
Oh, hello, is that Bronwyn?
Yes, it is.
Hi Bronwyn, my name is, I'm calling from Southend Hospital.
Hiya.
You alright?
Yes, thank you.
So you are coming for an operation of your nose?
Yeah.
And you've got the date on the 1st of September, is that correct?
Yeah.
Okay, so is it okay if we go through the pre-assessment questions?
Yeah, of course, yeah.
Okay, so how much do you weigh? How tall are you? And you walk okay, no problems? Appetite is okay? Do you have a partner? Any allergies, please? Are you on any medications at the moment? Never had any problems with your heart?
I was born with a small hole in my heart, but that healed up years ago.
You don't suffer from high blood pressure or anything like that? Do you have asthma? Don't get shortness of breath? You don't have a cough at the moment? Have you ever smoked? And have you ever had COVID-19?
About 7 months ago I did, yeah.
You are not diabetic? Problems with thyroid? Have you ever been anemic? As far as you know, if there was an emergency, are we okay to give you blood?
Yep.
Do you drink? When was your last day of period? No problems with your hearing? Do you wear glasses at all? And who is going to pick you up from, who will bring you and pick you up? Mom and dad?
Yeah, my mum and dad, yeah.
Any infectious disease diseases, or you've had many operations where you've been put to sleep?
Yes, this will be
at
my
general
10th.
anesthetic. Really?
Yeah.
You've been okay with the anesthetic?
Yeah, I've sometimes had sickness, so they do usually give me like the anti-sickness thing before I wake up. But besides that, yeah.
Did they give you antibacterial wash to use?
Yes, they did.
So it's a day case, so make sure you bring the dressing gown,
Yeah.
slippers, and something to read, a book to read.
Yeah, okay.
No jewelry.
Yeah.
And also make sure you don't have any nail polish.
Okay, yeah.
I have to talk to the anesthetist.
Yeah.
Because I need to tell them about that you've had so many surgeries. They need to know because they'll obviously they'll be putting you to sleep. All right, then have a nice weekend
Thank you.
all the best with the operation. I hope this one will do the trick.
Thank you.
Being the 10th one.
Thank you very much.
The best then.
Thank you.
Okay, then have a nice weekend.
You too. Bye.
Okay, bye-bye.
Bye. Oh my goodness. So, excuse all my crochet stuff. But the call is over. So many questions. Oh my goodness. Obviously, I know they have to cover everything. They were just asking about past medical history, medications, any kind of illness that I've ever had, any vaccines I've had, just like my whole life story. There was so much to cover, but a million questions later, I'm finished. She was asking me about my height and weight, and I haven't like measured myself in such a long time, so kind of just had to guess with that one. Besides that, I think I'm all good. She told me when to use the shower gel thingy that I have to use, and that's about it. I can't believe it's a week today. Bit of an update on how I'm feeling. Very nervous. When I think about it, it makes me feel sick. I'm sure everything will be okay. Yeah. So I'm just editing the footage that I filmed during my pre-op, and I decided to count all the questions that I was asked. Guess how many questions I was asked? I did cut a lot of them out because the video would have been so long, but I watched obviously all of it back. I was asked 70 questions. 70! Oh my goodness. Anyway, back to the video. So there are currently, first of all, excuse the pyjamas and the dog asleep on me, but there's currently 5 days until my surgery, I think. I just wanted to let you know how I'm feeling, because I'm going to be really honest and say that the last few days I've actually struggled quite a bit with anxiety. I mean, the other night was quite difficult. Couldn't sleep till like 4:30 in the morning when I finally fell asleep. And today it's literally been the only thing on my mind. Sounds crazy after having 9 surgeries, and this is going to be the 10th. But the reason that I wanted to talk to you and pick up the camera and just be like, this is how I'm feeling. One, just to let you know that it's fine to feel like this. You're not alone if you do, even though at times it can feel quite lonely because there's not someone sat right next to me going through the exact same thing as me right now. But just know that you're not alone, and it's okay to feel anxious. And also, I need to keep reminding myself that there's a chance this could be my last surgery after so many. Even though that in a way feels scary because I've always been under the care of a hospital for my cleft, it is also kind of exciting. I think this is the first time I'm feeling excited about the fact this could be my last surgery, because I won't have to go through this feeling again, and this feeling is not nice, you know, the anticipation of a surgery and of pain, and this is a feeling I won't have to go through again if this is my last surgery, so fingers crossed, we shall see. But I just wanted to tell you how I was doing today, and yeah, it's okay. You're gonna be okay. If you've got to go through this, you will be okay. I will be okay. We can do it. Good morning. So today's Wednesday, surgery is Friday, so there are 2 days to go, and oh my gosh, I'm so nervous. Oh, I'm starting to feel sick, like just thinking about it, but it'll be fine. I think today is the last day that I'm gonna add to this video, because tomorrow is when I actually travel down to Southend, so that will be in my surgery vlog. But I just wanted to give you one last update today on what I'm doing to prepare, and I was thinking of showing you some of the things I'm going to be taking with me or having here to help me recover, just in case you have to have this operation yourself or a similar one, and if any of these things may be useful for you to know. Let's get on with this very busy day that I have today. So this morning, because there are 2 days till my surgery, as instructed, I had to use this lovely stuff. Yesterday was the last day I could use my own shower gel and face wash and all of that, because from today, before my surgery, I have to use this. So today I have to wash my whole body with it, which I did this morning. Tomorrow I've got to wash my body and my hair with it, which I'm not looking forward to. And then Friday, the day of my surgery, I have to just wash my body with it again. So I wasn't sure if I was meant to wash my face with it, but I did do. I just didn't get it in my eyes. It's just like this disinfectant thing. I was expecting it to smell really bad, it didn't. So if you're wondering why on earth I'm sat on the floor, it's because I'm now packing for tomorrow, and I thought I'd just show you a few of the things that I'm taking, just in case it's useful for you to know the sort of things you might need. These are the first essentials. I have not decided which one yet, probably this one, but I've got this neck pillow. Apparently you're meant to wear it the other way around, but that's the way that it helps me. And basically this is really good for when I've had my surgery and I'm trying to get comfy. I tend to sleep on my side at night, but obviously that's not going to be the best idea when I've had surgery on my nose, so it'll be good to just kind of be like propped up in a good position, and this I have found from past experience that it has helped quite a lot. The next thing is mints. I've just got a ton of these tiny little things. We got them from the airport when we went on holiday. So I've got quite a lot of these mints, and these are really good for like afterwards if my mouth is going to taste of like blood and things like that. My throat might be sore as well, so it might be nice to have something to suck on, or if I feel sick, or just, you know, they have many uses. Next, tissues, and lots of them, and these are soft ones as well, which is very important for after surgery. I have a feeling that my nose is going to bleed. The last operation I had, my nose was bleeding like in the car on the way home and things like that for the next day or two, so they'll be useful for that. And obviously I'm going to be taking this with me, like I was explaining to you earlier. I have to wash myself with this before surgery, so I'm going to have to pack this. So because my lips are likely going to get very dry, I'm going to be breathing out my mouth for the recovery of this operation. So this is going to be very, very useful. Just some Vaseline and also lip balm as well if my lips are really dry. I'm going to probably go through a lot of lip balm too, but Vaseline is always, I feel like Vaseline fixes everything. I probably won't take these with me. I probably won't need them until I get home for like the recovery, but something I found useful from previous operations are these like cotton bud thingies, so I can use these to clean my nose and just make sure that, you know, all the incisions and everything are kept nice and clean throughout recovery, and it just aids the recovery process, I guess. It's just really good for like getting into little bits, but obviously being careful and not poking around too much, but these have been useful in the past. And then the last thing that I'm gonna like show you and recommend, because obviously I'm gonna be packing the normal essentials, you know, like toothbrush, my medication, clothes, underwear, pajamas, whatever, all of those essentials. But the last thing that I kind of want to recommend is a book, and I'm currently reading this, which is the Comfort book, and it is so good. I would highly recommend if you've not read it, and I just think it's going to be a really lovely thing to take into the hospital with me, because I'm likely going to be super anxious when I'm waiting for my operation, and this book is absolutely incredible at making you feel less anxious, less alone, and it's just so nice. Definitely recommend taking something to like actively keep your mind off of the surgery. So this book, especially if you've not read it, super good. Those are the things that I'm going to be taking with me or using for my recovery, like the main things that I think would be useful to mention. If you want to see my surgery and recovery, then you'll have to wait for my next few videos, because fingers crossed, if all is well and I have my surgery on Friday, I will be like vlogging the experience, so that hopefully people will feel less alone if they have to go through it as well. But I think that's going to be the end of my preparation video, because I want to kind of make sure I have time to get this edited and uploaded before I actually go to the hospital, because I'm not really sure what I'll be like afterwards. And preparation wise, I'm kind of like, all I've got to do now is just make sure that my room is nice and clean and ready for me to come home to on Friday, and I think that's kind of it. Obviously keep washing myself with this lovely stuff, and I can't really think of anything else. Anything else that I do, I will put into the next video, so like I said, stay tuned for that. But for now, that is it for my preparation video. I cannot believe that in 2 days time I'll be having surgery. But thank you so much for watching this video and coming along this journey with me. Good luck to anyone who is facing something similar. You can do it, we've got this, and it'll all be over soon. So yeah, bye for now, and I will see you all very soon. Hopefully. Bye!